Hello, my name is Lindsay. I'm a registered nurse here at Adaquate at Home, and I have been a clinician here in the last 5 years. I've been serving our patients, and I'm here today to give you a presentation on the concerns of inadequate staffing, the effects, and the plan to change these staffing concerns. Inadequate staffing in home health care facilities remains one of the highest straining issues that our home health care faces today. Hiring adequate staffing is a critical factor to determine the quality of care in our facilities. Also, the quality of care for our patients and the patient outcomes reflects directly on the staffing levels, which raises concerns about safety, increased numbers of falls, wounds infections, medical errors, and rapid increase of hospital readmissions. Studies have clearly illustrated a link between worker fatigue and poor performance. Inadequate staffing not only affects patient outcomes, but it also affects the nurses' physical and emotional health. I went on to the American Nursing Association website, which is a nationally accredited website that states that 1 of 2 nurses report insignificant time with a patient to perform their job adequately. 96 out of 100 nurses report fatigue at the beginning of their shift. 54% of nurses have exclusive workloads, and 1 of every 3 facilities are understaffed. 1 in 3, us being one of them. Ensuring adequate staffing levels has been shown to reduce medical errors and medication errors in general. It decreases patient complications, decreases mortality, improves patient satisfaction, reduces nurse fatigue, decreases nurse burnout, and improves nurse retention and job satisfaction. Our home health agency has recently merged into Sutter Care and Sutter Gold affiliate facilities. And with this recent change, our patient load has increased rapidly to the point that we cannot hire enough nursing staff to serve these patients, which is great. We have a high patient coming in, and this is great news. The company is growing. But with that, we have some negative impacts, which is not having the adequate staffing we need. An email is sent out every day with a list a mile long of patients that have not been assigned nurses for the day. So these are sick patients that need a visit and have a doctor's order to see them, and we are not complying with doctor's orders because we are not able to see the amount of patients we have. These patients are very sick and have been sent home from the hospital too soon and are at great risk of hospital readmission. Home health care agencies get penalized by the health insurance companies if the patients go back to the hospital less than 30 days from discharge. So that is something that not a lot of people know, that we do get penalized as a home health care agency if patients go back in the hospital too soon. So it is our job to send nurses out to care for them so they stay out of the hospital and give them the right tools to recognize signs and symptoms so they can stay out of the hospital. In order to do that, we need to have the right staffing. And to get reimbursed from companies, we have to follow their guidelines. So they are our way of getting income, and so we have to make them happy. Home health care revenue is about $73 billion annually, and my goal is to establish and implement a staffing hiring committee. Implementing this plan will ensure that each person carries out their roles while recruiting and selecting a staff, which will include interviews, introductions, orientation, a job description, pre-employment testing, and signing of contract will be implemented. To apply this hiring committee or this hiring plan and committee, an estimated $4,500 will be needed to adequately train and supply the staff with equipment. All employees will be hired and will need to pass a background and drug test and go through their hiring process. After the plan is fully implemented, we will compare the before and after hospital readmission rates, which will prove that hiring staff to serve our patients is the best way to make this company succeed. We will also send out a patient satisfaction survey to compare the quality of care of patients and their satisfaction. Also, to carry out these plans, the nurses will need the proper equipment, the tablets, medical equipment that they will need, and then, of course, a 90-day orientation. The goal is to hire only three full-time employees that will work full-time, 3 per diem. So per diem employees will save costs on insurance benefits, packages, and things like that. We will also hire 4 temporary employees from an outside temporary agency, which also will save money on overall costs. It will give us time to train the other employees. The temporary employees have already been nurses from other agencies, and it's through the travel agencies, so they will already be trained and they will not need benefits from our company. They are already benefited and they'll be ready to work within 30 days while we're implementing the rest of the nursing staff. Change within any organization can be a very challenging process, and this may seem like a lot for now, but for all those, it takes a very strong group of leaders within the company, which is vital to implement organizational change to be successful. I will bring forward this plan to a regional manager, discuss budget plans, and select the right personnel for a hiring committee. Commitment and cooperation from higher ups is also a necessary factor for the success of this plan. It is imperative to have an extensive orientation for these employees to display their talents and make sure that they're ready to go out in the field. With this plan, we will incorporate and take feedback from our employees, staffing from the bottom all the way to the top, because more loyal and committed employees that are involved, they tend to be more committed and loyal, and the organization overall will have less retention rates, which will spend less money on hiring. In the end, the implications for practice is to supply optimal staffing. It is essential to provide optimal patient care. That is the goal. Collaborative strategies that focus on developing long care solutions will improve the quality of patient care and their outcomes. Given the increase in demand in home health care agencies, we face challenges in finding staff and staffing levels, but I believe we can do it with this plan and this staffing committee. And again, several benefits of retention have been identified as such as patient safety, the quality of care of patients, the staff safety, overall satisfaction of the patients and nurses. Retention. We also reduction in advertisement and recruitment costs, fewer nursing hires, reduction in hiring costs, decrease in patient errors, increased quality of care, improve work environment, increase satisfaction, as well as increase in accountability. Implementing this plan would directly affect the major out-of-pocket costs for this agency, and it will help the insurance agency. It will bring up our score on the Medi-Cal and Medicare insurance agency, how they view things. After this plan is fully implemented, we will compare for after hospital rate and the patient satisfaction survey. All staff will be allowed to stress their concerns and feedback, develop open channels of communication at all levels and throughout the leadership. The process of creating change will be most successful this way, as well as assessing the staff's behavior and progress throughout the plan in the implementation phase is vital for finding out if there's any difficulty in changing the process. To accurately evaluate and monitor change in staffing process at the organization, a discussion will be made by upper management to establish a staffing committee. The main responsibility of the committee will include monitoring and evaluating weekly staffing schedule and the need for more skilled nursing care, to establish ground rules that ensure direct care, and develop goals, and just monitor the process throughout. The focus includes the minimal professional skill for each patient and identifying organizational employment practices. And that is my plan to implement a nursing staffing, increase our staffing. This is huge. This will, in turn, bring up more revenue, and overall, we're here for the patient, and this is going to improve the quality of care substantially. So thank you for your time. I'm here for any questions or concerns, and please fill out the survey so I can know how our presentation went today, and if there's any feedback, we'd like to hear it. Thanks so much.